muted. So welcome to this morning meeting with the faculty. Let's go back to that one then. We are going to talk about communication today. I'm going to talk about Johanna Erlandson. I'm the head of communications, and I'm going to talk about this. And my deputy Anna Hellgren is also going to talk about our external communications. And if you have any questions for us, there will be a short Q&A session at the end of the meeting, and then you can write your questions in the chat, and we will answer them at the Q&A session. Okay, so now let's get started. So I'm going to start with a bit of a quiz here. These are two very well-known global brands, and if you know who they are, you can write your answers in the chat, and maybe also a word or two about the emotions they evoke in you. And I'll come back to these in a little bit. So you have a few minutes to think about it. But let's start from the beginning. What is communication? So communication comes from the Latin communicare, which means to make together. So in order for a communication to take place, there needs to be more than one person involved. And it's something that we do together. And it's also fundamental for creating relationships, cooperation, achieving common goals, creating a common culture, and maintaining social structures. There's also a more technical way of looking at this. It's a process. Communication is a process. And here you can see a very common illustration of that communication process that is often used. So when you're communicating, you need to adapt your message to the recipient of that message. And there are some areas in this process that are more fundamental for that communication to take place. So let's use an everyday example. So you work in the lab, and you have some new rules for how to work in the lab for safety reasons, and you need to let your colleagues know about these new rules. So you write a list of them in an email and send it out. But the next day when you come to work, one of your colleagues is working in the lab in the old way, disregarding the rules altogether. And you get very frustrated because you feel like you've done your communication job with the rules. But what could possibly have gone wrong here? So there are a few places, as I mentioned, in this process where something could have happened that made this not work the way you intended it. So let's start with the one that we called coding. So you need to think about, maybe was email the right way to communicate to this colleague? Or do that colleague want their information in a different way? Do they even tend to read emails? Or is it usually better to talk to that person? And also things like, does this person like to follow rules? So are they likely to quickly take in a list of rules, or do they like to not follow rules? So maybe what can you do to make your message land right with your recipient? What motivates them? Secondly, you have a place where we call interference. So interference could be, for instance, you send your email, but at the same time that you send your email, everyone else, the recipient gets a lot of other emails, so your email gets drowned out with the other messages. Or maybe the person who you send it to have a child that is sick at home, and they are worried about their child. And there are a million different reasons that could interfere with your message before it reaches your recipient. And then finally, the place that we called decoding here in this image. So maybe your colleague is not very good at remembering lists. Maybe they need the rules in a different way for them to be able to follow them. Or maybe your colleague needs to ask questions before they know how to implement the rules in their daily work. Again, here it really makes a difference if you make an effort to try and understand the person you're communicating with. What motivates them, and how can you make sure that your message lands in the right way with them and that they act according to your communication? Because the important thing is not what you send out, but what sticks in the brain of the recipient. And that the communication accomplishes the goals that you intended for it to do. And to help with that, you can make a communication plan before you start communicating. Maybe you wouldn't do that for a simple thing like the rules, but for anything that you do, you can always ask yourself these 4 questions before you start communicating to make sure you do the right thing and you have the desired effect of your communication. So first of all, why? Why do you want to communicate? Does the communication, what is the problem the communication is supposed to solve? And it's actually communication even the right way to solve your problem? So that's a good first question. Why do you want to communicate? And what's the purpose of the communication? And then who? So who is the person or persons that you want to communicate with? What motivates them? And what do you want them to know, feel, and do after you have communicated with them? And then the question, what? So what is it that you want to tell them? So what is the key message that you want your recipients to have received at the end of the communication? And then finally, where? Where can you reach your intended audience? What channels should you use? And to help with this, we have there is a simplified communication plan template that you can find on Intramed, which has these 4 questions and some supporting questions as well in it. And there you also find an activity list. So once you've answered all these questions, you can fill in the activity list and see what exactly then, are the actual actions of communication that you're going to do. Okay, so let's get back to the quiz. I got a few answers here, and I think you're all right. Of course, these companies are IKEA and Coca-Cola. And it's even though there's nothing in this actual image to tell you that this is IKEA and Coca-Cola, just the fact that you've been able to recognize them just out from these pictures is a testament to how well they've worked with their brands, both visually and also the content of their brands, so that you can understand. Like IKEA, for instance, very informal, very direct, for instance. So then we come to us. So Lund University, that's our brand. And that's it's our brand wherever we work, whatever faculty we work at, whatever research center or whatever we work in, Lund University is our brand. And that comes with a few rules. This means that everyone who works at Lund University, regardless of how you are financed, you are required to adhere to the university's graphical standards and also the brand guidelines. And this also means that if you, it's not allowed to create your own logo, for instance, for a group or a research center. You have to use the Lund University logo in everything you do. And even this presentation is actually in the correct template for PowerPoints for the Lund University brand. And it's also important because this is our brand. So it's important whenever you communicate externally. So if you have collaborations, you go to conferences, speak to media or in public, you need to make sure that it's clear that you come from Lund University. And this is the same if you're an affiliated with your Lund University and work, you work at the region. You still, whenever you go out and speak in public, you need to make sure that you make it clear that you do your research at Lund University. And it's important that we do this because we build this brand together. And the better we can do this, the stronger the brand will get and the more credibility that will lend to our research and our education. So just to remind you. And now I hand over to Anna.
Thank you, Johanna. Yes, so my name is Anna Hellgren, and I'm the deputy to Johanna and the press and information officer at the faculty. So I will give you a quick overview of the faculty's external communication, starting with the press and media work. The people in the press team are writers with journalistic background, all specialized in research communication. Our mission is to make complex research accessible accessible, translating academic findings into stories that the media, the public, and other stakeholders can understand and engage with. So we work closely with researchers to identify what counts as news, to shape press releases, and to connect with the right journalists and outlets. So in short, the press group is here to ensure that the important research work is coming out of our faculty, reaches beyond academia, and has an impact in society. Right, so how do we do this? We do this through press releases and direct contact with key journalists. We use criteria for evaluating what qualifies as news, particularly when it comes to research findings and scientific publications. To support this, we have a form available for researchers. You can find it on Intramed, helping both researchers and us to make clear assessments. We also monitor media continuously to stay updated on current topics and opportunities. And in addition, we have a formal agreement with the Skånes universitetssjukhus for cooperation on press releases and related communication. And we also offer media trainings to researchers and groups when it comes to external communication. Yes, and here are a few examples of when our research gets national attention in national media. And then I would like to say a few words about The Conversation, which is a platform and collaboration between academics and journalists and has been running for over 10 years. It consists of a global network of nonprofit media outlets with editorial offices around the world. All articles are published under a Creative Commons license, which means they can be republished freely in other channels without editing. And for Lund University, The Conversation is the most important international channel for sharing our research. Articles are written by academics and researchers with editorial support from professional journalists. And the topics, they must always connect to a current societal issue. We actively recommend our research to contribute, including responding to expert requests from The Conversation. So if you're interested in writing for The Conversation, you're more than welcome to contact us. And here we have a few examples from this year where we have Martin L. Olsson, David Gisselson Nord, Christel Nilsson, and Alexander Santillo. And they are all researchers at the medical faculty and have been published on The Conversation. Yes, and then we have our social media where you can follow us. We are on LinkedIn, where we focus on research, and you can find us on Instagram. This is our channel that is dedicated to students, and we're also on
Or if
Yep. Sorry. And you can also find us on Facebook, of course, where we focus on events. And yeah, we have quite a few followers, so please follow us and share to spread the news. When it comes to our websites, we also reach our external audiences through these, and we have websites in both Swedish and English, and these are aimed at a broad audience, including the general public, collaborators, funders, prospective employees, and more. And I would also like to add that we are very restrictive to start up new websites, so please contact us for advice before creating a new website for your research group. As part of our outreach work, we organize events. We have Kulturnatten coming up here in September, and then we have the Kunskapskrogen and Forskningens dag, for instance. And you can find all the information about our external events on our website. And of course, we have two super important target audiences, which is our students. And we have prospective students, for those considering studying at Lund University. We're focusing on several key initiatives. In February, Lund University will launch a brand new website that brings together all education information in one place. And As I mentioned earlier, Instagram serves as our primary social media channel for recruitment and engagement with future students. We also meet high school students through the NMT days, giving them a chance to explore our programs and campuses. And for our current students, we have a website that is called the Student Web, where you can find additional information and updates through on the Student Web, whereas all course-related matters are handled directly by the Education Office.
Yes, and so we'll go to internal communication then, and we'll start with the most important channel that we have when it comes to internal communication, which is Intramed. So this is our channel. It's a work tool for the faculty's employees. Here you can find the latest up-to-date information about work processes, tools, organization, and staff. And you also find the latest news here at the top of the page. If you have a Lund University computer, you will have Intramed as your default starting page in your browsers. And if you don't, please add it as your starting page, because this is the place where you can find all the information that you need about the faculty and what goes on here. And we have mirrored versions in Swedish and English, so you can find the same information in the Swedish and the English Intramed. We also on Intramed link directly to pages on the staff pages, that Lund University staff pages. So if you, for instance, there's information that you need to find at the staff pages, you can always find the relevant link here on Intramed as well. So you only need to keep track of Intramed to get all your information. We also have newsletters at the faculty. There's a faculty newsletter which comes out monthly, and it consists of a letter from the dean or the leadership team, and then also feeds from other sources, mainly the internal sources such as Intramed and staff pages and the calendar, but also from our external web and from the research portal with prizes and awards and other things. So it's a good source to find all our different channels. And then we also have department newsletters. They come every month or less often in some cases. And here you get messages from the department leadership teams and other department news. We also have a special newsletter for our managers called Manager Alert. It's a channel for managers with direct reports. And we do this together with HR and the finance team. And the point of this is to make it very short, and it's supposed to be task-based. So you get a full overview as a manager of what the tasks are that you need to complete in the current month. And you can also get some tips and reading quick links to important places for you to use as a manager. And this also comes out monthly. And to make it easy to keep track of how can you get your internal information, we have put together this overview image of how we communicate internally. So here you can see the channels that we use on different levels in the organization. So for instance, if you on faculty level, the most important channels to keep track of is Intramed, the faculty newsletter, this morning meeting, and the research portal and other general meetings, and so on. So here you can see it goes from left to right, the sites of the team here. So you can find the channels that we use for faculty level, the department level, what you should use at group research group and unit level, and the team level. And then also here's a separate section for managers who have a few other channels, such as the Manager Alert. And you can find this overview on Intramed. So it makes it easier and you can also use this, for instance, if you get new employees and you need to tell them where to find information. This is a very good overview to use for them. They get a quick grip on what's going on here. Yes, and then we have also another channel which was not on that image, which is our information screens. We have them in Lund, including at Medicum Village and in Malmö. And this is for advertising content internally. And here you can advertise anything, not everything you like, but if you, for instance, have events or conferences, you can advertise here. And you find You do that by filling in a form that you can find under Communicating within the faculty on Intramed. And we have one set of screens for the employees, and there's also a smaller set of screens that are targeted at students. So you can let us know if you want which screens you want your information on. What you cannot have here is information about dissertations. We do not show that, but other types of information you can advertise here. And then finally, all you need to know is actually, you can find it on Intramed, of course. So under the Support and Tools tab, you can find Communication and Graphic Profile. And beneath that, you find all the other information, such as communicating outside the faculty. And there you can find how you reach a press office if you want to share some research you've done or similar things. And you find also the communicating within the faculty, which here you find the form for the screens, and you also find the overview of the communication channels at the bottom there. And finally, of course, if you have any questions about communication or need help with anything like this, if you need to plan something, if you need to read media or anything, or need training in communication, please reach out to us. You find our contact information on Intramed, of course, under Organization and Governance and the Contact tab there. And this is the communication team at the faculty, and we look forward to hearing from you. And now it's time for some questions, and I'll just stop sharing. Okay. Yes, so we have a few questions here. So let's start with, might it be effective to tag LU when posting in LinkedIn? Good chance that LU will repost if the topic is deemed relevant, or better instead to send an email to comms team prior to posting on LinkedIn. Thanks. Can you tell us a little bit about that, Anna?
Yes, I think it's a good idea to tag Lund University, but that does not imply automatically that they will reshare your post. But they will see it, and perhaps someone working at the on the central level will like it or share it in their personal on their personal LinkedIn account. So I would always say it's a good idea to tag, but don't count on Lund University to repost it automatically.
Okay, and then we have another, it's more of a request, but as a new employee, it would be very helpful to have this presentation as a PDF so you can look at it and see where you find the different communication channels. So we can actually absolutely post this presentation as a PDF on one of the communication pages.
Jag lägger till 2 till mappen till Patrik.
Sorry.
Thank you.
Okay, sorry. But as you say, as you saw, you can find all this information in one way or another on Intramed under the communication chapters there on Intramed. And also this, we'll edit out the beginning, but this morning meeting, the recording of this morning meeting will also be posted on Intramed, so you can re-watch this if you like at a later date. Yes, and then we have a question about, I want to start a website. What do I do to start a website? And I can tell you, before you start a website, always contact us. And or if you want to start a website, we can look at that. But what you need to do is we start with having a conversation about your actual communication needs. And then when we looked at your communication needs, we can then see, is the website actually what you need, or is it something else, or could it fit in with other pages on our the actual website that we already have, and then we look into that, and then we can make an assessment of whether or not a website is the solution for you, or if you need do something else with your communication. So again, it's the question of the where question that we had in in the communication plan. Okay, and there's also on Intramed, there's also, as this is a response to the previous question, on Intramed, there's also another way to get into finding information about communication channels or ways of communication within the faculty and the university. And it's under the to be a new employee on Intramed. There's a tab there, or in Swedish, att vara nyanställd. There you can find a lot of useful information about where you find information about communication and communication channels. Okay, I think actually that was the end of the questions that we have today. And again, if you have any questions or you need any help with communication, please reach out to us. We are here to help you. And you can talk to me or Anna if you feel more comfortable with that, or you can reach out to anyone else of our colleagues here in the team. And we'll try to make to help you as best we can. Okay, thank you for today, and see you in September.